Good afternoon. David Sweat, Deputy Director, Shelby County Health Department, and welcome to the City of Memphis and Shelby County Joint COVID Task Force press briefing for June the 10th. Getting right into the numbers, we've had 99,137 cases reported in Shelby County. We've had 7,446 cases reported from Tipton County in Tennessee, 5,167 from Fayette County, Tennessee, 22,217 cases from DeSoto County in Mississippi, and 5,772 cases reported from Crittenden County in Arkansas. As far as key metrics, we had 33 new cases reported yesterday, and over the last week we've been averaging 44 new cases per day. We have 462 active cases, meaning 462 cases diagnosed in the last 14 days. The last time that we had that low a number of active cases diagnosed in the previous 14 days was during the first month of the pandemic back in March of 2020. So we've come a very long way. Now, unfortunately, we have had 1,681 deaths from COVID disease in our community so far during the epidemic, but our current positivity rate is 3.6%. The reproductive rate of the virus is at 0.78, and our, all of the metrics are going in the right direction. Things are shrinking in terms of the future epidemic, and we need to celebrate this moment and recognize that it's been a lot of work from a lot of people, but it's also been a tremendous response by the citizens of Shelby County to come out and get vaccinated, because it's the vaccinations that have enabled the metrics to improve to this degree. And so far, we've documented 369,299 people in the Tennessee Immunization Information System, and we are averaging 1,591 new vaccinations per day on average over the last week. That is up by about 500 people per day over where we were a week ago, and we have now reached 52.8% of our vaccine campaign goal. And when we look at our population breakdowns for all age groups 45 years old and older, we have more than half of the population vaccinated. The highest, in terms of age bands, the highest age group in terms of vaccination are our 65 to 74-year-olds, and those folks are vaccinated now at 76%. So 76% of people between 65 and 74 have now been vaccinated. At the youngest end, we have our children, 12 to 15 years old, and 13.7% of them have been vaccinated, about 6,900 children. And when we look across our zip codes, at the lowest end over in the western side of the county in South Memphis, we have some zip codes that have been vaccinated at a rate of about 23.4%. That's at the low end. And then over in Germantown, we have the highest proportion of the population vaccinated, which is 64.7% of the folks living there have now had at least one shot or have completed a 2-shot series. We're approaching 40% of the population in the county being vaccinated. So with more about the progress and continued efforts on vaccination, I invite Chief Doug McGowen to the podium.
Thank you, David. Certainly some good news, but we are not across the goal line yet, and the best way to secure our victory is to get your vaccination. As David said, more than 650,000 vaccines given. We have almost 375,000 people vaccinated at least once, and we're coming close to 300,000 people who are fully vaccinated. We're at 290,000 right now, so let's try to get across that 300,000 threshold by the end of the month if we can. Let me talk a little bit about the offerings that we have. As you know, there are more than 100 private providers, whether they be pharmacies or clinics, where you can get your vaccine, and that's where more and more people are taking their vaccine. We talked some number of months ago about the normalization of vaccine, and that's actually what we're seeing. A majority of people today are getting their vaccines from a private provider. But we will keep, during the month of June and July, a pretty robust capability for drive-through vaccine. The remainder of this month, we will have 3 locations: the Pipkin Building, Whitehaven at Southwest Tennessee, and Germantown at the Baptist Church there. Pipkin Building is open Tuesday to Saturday. Whitehaven is open Monday, Wednesday, and Friday. Their last day of operation will be the 25th of June. The Germantown site is open Tuesday to Thursday, and their last day of operation is the 24th of June. As we move into July, the Pipkin Building will be our sole mass vaccination site with drive-through service. They will operate from Wednesday to Saturday at the Pipkin Building, and we will keep that in operation. Today, our plan is to shut that down on the 31st of July if the numbers continue to trend in the direction that we believe they are trending. After that, we will set up a clinic at our Office of Emergency Management that will be our public clinic during the months of August and September. It will not be quite the volume that Pipkin has, but it will still be available for people who need a public vaccination option. But during that time, our healthcare navigators are continuing to provide concierge level service for people who are homebound, and they've done thousands and thousands of people in their homes. If you or someone you know needs a vaccine and they cannot get to a vaccine site, you can go to the covid19.memphistn.gov website and register, and we will come to you in your home if you are homebound. If you simply need a ride, there really is no excuse not to be able to get it, because we have, through a partnership with 901 Ride Choice, a free ride for you or your family member to get a vaccine. We'll pick you up at your home, take you to the vaccine site of your choosing, and then take you back to your home. That is through a program called 901 Ride 901. The number to call is 901 Ride 901. It's free rides to vaccine. There's the website, 901 Ride Choice. Just dial the number 901 Ride 901, and they will take you to a vaccine site of your choice. The only caveat is it can't be just a drive-through. You actually have to get out of the vehicle, go in, get vaccinated, then we'll take you back to your home. In addition to homebound, homeless, and rides to vaccine, we're going to continue our public partnership with organizations to provide events where vaccines will happen. There are, in June and July, have a list of approximately 34 locations where we will be doing vaccinations almost every day in June, and we're starting to fill up in July. Shelby County Government, Idlewild Presbyterian Church, the Campus School, Salon Monarca, Memphis Music Initiative, Wiseacre Brewery, and on and on. If your organization would like to have a vaccination pod or an event, you can also go to that covid19.memphistn.gov website and register or submit some information, and we will get back to you about holding a pod. Our teams are in the street. I think that's some of the reason that we've had an uptick, is we're going door to door in partnership, Shelby County Government, Memphis City Government. We have teams in the street that are going house to house, sharing the message of importance of vaccine and trying to break down any barriers that people have. We also have a phone bank in partnership with the University of Memphis. Much like a political campaign, they are calling people at their home, asking them about their interest in vaccines, trying to help them overcome any hesitancy, and basically getting the word out about the opportunity. That really is how we are attacking vaccinations over the next few months. We will obviously change if we have to. If we see a need to pivot, we will do that, just as we have all throughout. When I was here last time, there were questions about the sweepstakes, and I'm pleased to report that we actually have selected a winner for our Shot for a Shot sweepstakes. 650,000 vaccines. We had 45,000 people get vaccinated during the month of May when the sweepstakes was going on, and we had 24,000 people enter the sweepstakes. And today, we have selected a winner. Miss Sandra is her name, and we'll give her full name here. There will be a release coming out later on. But we are very pleased, both for her and for everyone who has taken the opportunity to get vaccinated. That really is our best shot at returning to the activities that we love, making sure that our community is as vibrant and active, and that we keep at bay the virus. So we're very thankful for all of you who've gotten your vaccination, I would encourage all of you who haven't to still get out there and do so. It's free, it's easy, it's convenient. And I'd also like to say a word of thanks. Our sponsors don't want to be recognized, but the folks who contributed the money so that we could do the sweepstakes. We couldn't have done it without you, and we're very thankful for your civic mindedness and for offering that. We really did maintain our level of vaccinations during that sweepstakes when other cities saw a dramatic decline. So we're very thankful. Very successful vaccine campaign, very successful sweepstakes, but we encourage folks this month and next month to really get out there. Let's push our numbers well over 40% in the community who've been vaccinated. So with that, I'll take a break and answer any questions that you may have.
Mandy Rock, Fox 13.
Hi, good afternoon. I have a question just about when we might reach herd immunity. I know that you have said previously that about 70% of people in our county have some kind of immunity through infection or the vaccine. And I know at one point that was what was said it would take to reach herd immunity. So I just want to know where we stand when it comes to that.
Sure, that's a question for David. He's the resident epidemiologist. He can tell us if that number has changed and what we should be looking for. David?
So thank you for the question. So the study that is ongoing at the University of Memphis and AEL showed us that at the end of May, or as of the end of May, 71% of the adults, I want to emphasize it's just the adults in Shelby County, show some kind of immunity to COVID-19, either through natural disease acquisition immunity or vaccination immunity or both. So taken together, 71% of the adult population has some level of immunity to the virus. Now, for the children, it's less. In fact, probably about 85% of the children in Shelby County remain vulnerable to COVID-19. They do not have evidence of infection or immunization. So we still have certainly more than 250 to 300 plus thousand people in Shelby County who are susceptible to the disease. The complicating thing, when we had the original virus of COVID that hit us a year ago, if we had gotten to 70% of the population being immune, that would have been herd immunity. But the predominant virus that we're dealing with now is not that virus. It is what is called alpha, the variant called alpha, or you may have heard it referred to as B117. And that virus is more transmissible. And it also causes slightly more disease, more severe disease. And so that pushes the herd immunity concept to a higher level. Probably about 85% of the population would have to have immunity before we would say, okay, that's herd immunity for that virus, because it's just so easy to transmit. And unfortunately, that's not the worst news. There's Delta, the virus that had caused a tremendous amount of difficulty in India, that is now becoming a much more problematic virus in the United Kingdom, and news reports show that it is on the rise in the United States. Well, Delta is even more easily transmitted than Alpha was, or the B117. So these variants complicate the answer to the question. What we would say, though, is right now in our community, the Alpha variant is a variant that the vaccine protects you against. It's the dominant virus we have, and the more people we can get vaccinated, the better off we're going to be, and it's the reason that our numbers are dropping to the levels that they are right now. And all of that is subject to change if a new variant emerges that the vaccine does not protect against.
Thank you so much. And my second question is actually about the Delta variant. I'm wondering if you can confirm if we've seen any cases here in Shelby County, and if you are concerned about the spread of that here.
Yeah, so we have had a few Delta variant cases. We had an early cluster in May that was associated with returning travel from India. That one was isolated down, And then yesterday, we got another Delta variant reported to us, so that one's under investigation at the moment. We don't have a large number of those in the county, but we've had a few.
Kelly Roberts, WMC.
Hey there, good afternoon. My first question is about this new health directive that's supposed to go into effect this weekend. I know that basically the main change is that it's really doing away with any of the restrictions that kind of lingered in our current and the last health directive. And I was seeing if anyone could kind of compare them, what the changes we will see. It seems like when I was reading the two, one of them, is it correct that employees in certain industries do not have to wear masks now, like service and healthcare? What other major changes could businesses and organizations see?
Right, so thank you for the question. There is a new health directive out. It goes into effect on Saturday. And basically, what it ultimately does is remove any required restrictions in the vast majority of cases. What does remain in place is that if any organization, place, or business has a sign posted for patrons as they enter into that location saying that a mask is required, in that instance, it's still required because it's their business, it's their property, and if they want to require patrons to wear a mask to enter that location, they are allowed to, as business owners or organizations, to require that. And if they do, then we have to comply with that request. But generally speaking, once the new health directive goes into effect, if you're fully vaccinated and nobody that you're entering their business or organization is requiring you to wear a mask, you don't have to wear a mask if you don't want to. If you're unvaccinated, you also are not going to be required to wear a mask, but that comes with a recognition or acknowledgement or an understanding that if you're unvaccinated and unmasked and moving about through the community, your risk of encountering COVID and becoming infected is greater. And as a personal choice, if that's a choice you make, then that is your choice. But you're still not out of the woods because there is still, on average, about 44 people a day being diagnosed with COVID in our community, and we have pockets of vulnerability that remain. But you're not going to be required to wear a mask unless that business you're entering has a sign posted that says you have to, and in that instance, you do.
Thank you. And going back onto the Delta variant, we know that it seems like more international travel will be opening up this summer. President Biden is in the UK right now talking about travel to and from the US and the UK, and we know that the Delta variant is currently hitting the UK, especially the younger people, pretty hard right now. With this continuing to loosen restrictions, with these new health directives and the possibility of more international travel to and from Shelby County, what are our concerns like moving forward into the summer with this Delta variant, or are we in a good position with the numbers and the trends we're seeing right now to maybe skirt some kind of large transmission?
Well, there's a lot of things there, so I'll try to unpack that. As far as are we in a good position? Yes, we are, given the viruses that are in our community and spreading right now. Now, as I said earlier, if we get a variant into the community that the vaccine does not protect us against, we're going to be back in a situation where everybody is susceptible again and at risk. And if that arises, restrictions may have to return. That's a decision that will have to be made in the future if that happens. But as far as what are our safeguards against Delta, we continue to have good surveillance. We have a more robust sequencing capability than most communities in America, and certainly most communities in Tennessee, meaning that a greater proportion of diagnosed cases in Memphis and Shelby County will have their virus sequenced and will know what version it is. And then anytime we find one of these variants of public health concern or high-risk variants, of course, we're aggressively investigating and responding to all cases, but we would prioritize those, try to isolate those cases, quarantine those contacts, and prevent the further spread. We've been successful several times with that. We've been able to protect against variants out of Brazil. We've been able to protect against the Delta variant so far through that isolation of cases, quarantining of contacts, identification through surveillance of these. But the B.1.1.7 or the Alpha variant was able to get established, and there is always a risk that a variant can do exactly what the Alpha variant did and become a dominant virus.
Daniel Connolly, Commercial Appeal.
Yes, thank you. So some jurisdictions around the country have seen spoilage of vaccine inventory related to low demand for vaccine shots. What is going on here in Shelby County related to that?
I'll invite Doug to address that. Thank you.
Thanks for the question, Daniel. There is no spoilage happening because of expiration. We thaw what we think we need every day, return it to inventory, and then we have about 5 days to use it after it's been thawed, or exactly 5 days, and that's the first thing we issue the next day. So the inventory that we have on hand today, doesn't expire till the end of August / beginning of September. So we still have several months to use it. At the pace we're going, we're not ordering more because we think that's about the right amount for us to have. We stay in close contact with the state. Where other cities or municipalities may need it, the state is doing a good job of balancing that inventory. And so they're asking people to transfer it from place to place just to make sure that that doesn't happen. So it's a really good question, but I do want to let you know there's a really good process in place to make sure that that doesn't happen. Now, should we see a dramatic decline in demand and based on our inventory, we will work with the state and other agencies to make sure that we offer that up for other people to use. But as of today, there's not risk of broad-ranging spoilage because of demand.
Okay, thank you.
Hannah Grabenstein, MLK 50.
Hi, my first question is about the increase in vaccinations this week. I know you mentioned briefly that you can attribute some of that to the street teams. I'm wondering if you can talk a little bit about, what the street teams are noticing and what they're doing, and then if there are other reasons for the increase in vaccination, what are those?
So it's a really good question. And again, I think we have anecdotal evidence. Wouldn't have anything that would be empirical or provable. But I do think that the phone banking and the urgency that is given when people are going door to door helps drive some of that. We are seeing more young people come, so the percentage of young people is ticking up, parents bringing their children to get vaccinated. So I believe that's a contributing factor as well, since many of the schools are now out. Other schools are finishing up. That's more availability to get kids to come and get vaccinated. So we keep track of the number of young people that are getting vaccinated, especially children. And so I don't have anything to report back that would be empirical evidence as to what the street teams are saying, only anecdotal. Many of the people we're talking to, as I mentioned before, either say they have been vaccinated or say they will be vaccinated. They're just waiting for their time to go do that. And then the uptick, we're pleased to see, but as you saw back in February, March, I guess it was March and April, when we saw the dramatic decline, there really was no, one smoking gun, so to speak, that said, here's the reason why it's tailing off. So I can't give you any evidence. All I can say is that we're pleased that it's happening and we're doing everything that we believe we can do. Having talked to other municipalities, the folks at the state, and even some of the federal agencies to ask for advice about what else we might do to drive up demand.
Cool, thank you. My follow-up is for David. I know that as a country, we're sort of grappling with, are we, masking in this place? Are we masking outside? Are we masking indoors? And I recognize that we have various requirements that have been lifted and that businesses can still impose their own requirements. But I was wondering what you personally recommend. Do you think that fully vaccinated people need to be wearing masks in any particular circumstances? And also, what do you do when you are in public?
Well, thank you, I appreciate that. Well, so far, when I've been in public, I get out of my car, I put on my mask, and I go into my grocery store or go into place of business, I'm wearing my mask. I mean, I've continued to maintain that practice. In our offices, typically, we have people wearing masks, unless we're in small meetings where everybody we know is fully vaccinated. Then we might take off the masks, but it's because we know that everybody in the room is vaccinated. As far as what my intentions are going forward is obviously comply with the health directive. When I'm walking my dogs in the neighborhood, or I'm riding my bike on the Green Line, or taking a walk over the bridge across over to Arkansas and back, no, I don't typically wear a mask when I'm exercising or doing those sorts of activities. As far as my recommendations, I think it's important for you to do what you're comfortable with. We have some folks who work with us, for instance, in the health department, who are fully vaccinated, but they're also vulnerable because of advanced age or underlying conditions, and they want to continue wearing a mask to protect themselves. And I would say if you are in a similar situation where you feel more comfortable wearing a mask, you feel safer wearing a mask, do so. Wear the mask. There's absolutely nothing about relaxing these requirements that says you cannot protect yourself in the way that you wish. So you can voluntarily wear the mask as long as you wish. And as far as, but the other part is if I'm going into a restaurant or I'm going to a grocery store or a business or some place, and there's a sign on the door that says you need to wear a mask, I mean, I'm absolutely complying with that.
Those are all of our questions today. Are there any closing messages?
I think one of the things that I just want to say to everybody is that we have come a very long way as a community. We went from a place where 937,000 of us were susceptible to this virus to a place where now 71% of the adults aren't, 15% of the kids are not. We're immune for the moment. And there's been a lot of work along the way and a lot of collaboration from many different partners to bring us to this point where our positivity rate is down, our case averages are down, the future epidemic is shrinking, and we have the fewest number of active cases that we've had since the beginning of the epidemic. So thank you for everybody for the work you've done, because you're the ones who've achieved this. You've gotten vaccinated, you've social distanced, you've worn the mask, you've complied with isolation orders, quarantine orders, and other measures that have been introduced along the way, and we have gotten to a better day. And so as we're entering the summer, let's enjoy it and appreciate that everybody has worked hard to get us to this point. So I hope you have a good weekend.
Thanks, everyone.